Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Thank you for joining us today. My name is Renee Edgar, registered nurse at Mahaska Health. Today for a vaccine update is Patty Malloy, public health coordinator at Mahaska Health, with 30 years of experience as a registered nurse here. Patty graciously offers to take time out of her schedule to update us all in the community on the vaccine updates. We tend to follow a little pattern here. We talk about our tiers first. So Patty, give us an update.
Yeah, so we continue to work in phase 1B, which is people 65 and older and people in the workforce that can't social distance that are in manufacturing, and inspectors kind of is tier 4, correctional facilities individuals is tier 5. We've also added into that the 64 to 18-year-olds for our Moderna vaccine with underlying health conditions. So that's where we're at this week. Moving forward, next week, we will be able to vaccinate even more Iowans, and that will include anyone 16 and older. Currently, public health has the Moderna, and that age group will be 18 and above. For Pfizer, it's 16.
Wonderful. Give us an update on where you see that and how you're streamlining what you're being allocated, and if you foresee those allocations changing soon.
Yeah, there have been different times, I think, in the last few weeks that the allocation to Iowa has, we've seen an increase. We've seen some Johnson & Johnson come in, and those doses typically go to larger metropolitan areas that have, or larger manufacturing areas where they can do a large number. They do the one dose and they're done. So that's kind of where they've put that Johnson & Johnson. The other increase in allocation has been with Pfizer, and those are going again to areas that can house the Pfizer vaccine. So we know that one of our pharmacies here in Mahaska County, Hy-Vee, does get the Pfizer. That's the ultra cold. So storing that is just, it has to stay ultra cold until you're ready to deliver it, and then it has to be given fairly quickly.
Great. So when we're ready, you're still continuing talks with a max vaccination clinic and plan.
Yeah, so here in Mahaska County, public health is still being allocated the 400. We don't know from week to week, nor does the state know always how much their vaccine is going to increase until midweek is when they do a lot of their meetings. So I know sometimes it's frustrating to not know too far in advance, but that's kind of what the state's dealing with along with local public health. So currently, Mahaska County Public Health is getting the 400 doses. We allocate 100 doses to Mahaska Drug. Hy-Vee gets a different distribution from the federal government pharmacy program, and Walmart will be looking at getting federal distribution as well, still to be determined at this point.
A number that we love seeing increase from week to week and hearing from you are the total amount of Mahaska County residents who are vaccinated.
Yeah, currently in Mahaska County, we've had 7,640 doses going to Mahaska County residents. So remember, some of those, it takes 2 doses to be covered with some of the vaccine, but we have 2,578 individuals that are considered completed with their vaccine, so that they've received their second doses, and that number changes daily.
Yeah, it's always great to see that number increase, and I know your continued effort to get those vaccines out in a timely fashion are really impeccable to the community. So thank you, Patty. Give us an update on the call center, and what do people need to do to get the vaccine?
Yeah, so currently here in Mahaska County, to get a dose of vaccine, you need to sign up at the call center. So there's a link that you can sign up online, or you can just call the call center directly and they will help you get registered. When you're registering, you're basically giving them your name, where you live, and then any underlying health conditions. So what we've been going through is, first we were hitting the 65 and over, getting that population vaccinated. Then we went to those that had specified they had underlying health conditions. And we've talked to the call center, we talk to them quite frequently, and they're telling me that their list is the calls are being made. So if you haven't yet signed up, please do. Even if you don't fit the current criteria, but you want one when we open up to the general public next week, we want to get you on the list as soon as possible, because that's who's making the 400 appointments here in Mahaska County for Mahaska Drug and Public Health. For Hy-Vee, it's still automated, so you'll have to go on and do their automated system, which is how Walmart has to do it as well.
And just a reference, when you specify online, that is at mahaskahealth.org is that option. At top of the page, a blue banner will get you a direct link to that vaccination sign up page.
Yeah, there, or the Public Health Facebook page also has the link to the call center too, and the phone number as well.
And always a reminder, once you have qualified for a vaccine, you are always qualified.
Correct. So if anybody, works in one of the tiers, in the healthcare tier, or, it's been to their business and they've decided, after, a lot of people get vaccinated, you're like, well, maybe I should do that too. At any time you can sign up and, we'll get you called. So go ahead, sign up at any point. And we want people to be vaccinated.
And you brought up a really good point. You are continually going out to businesses still.
Yeah. So with our occupational health, we have a team that can go out to some businesses depending on, the number. Some businesses we do here, but it's going really well. So if you, feel like you fit in the criteria of the tiers and want to be vaccinated, give us a call and we will get something set up for you.
As always, the health and safety is the top priority here at Mahaska Health. So Patty, thank you for your time again today.
You're welcome.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.